Julio.
I don't count.
He doesn't count towards quorum.
Just, and all. Yes.
Good, how are you? At 6:30, so I'm gonna start the webinar.
You started?
Yep. That's the meeting started.
We will, thank you for joining online and in person. We'll start in a few minutes. Madam Chair? And hello, Rosie. Oh, I'm just,
I'm Jeremy.
nice to meet
Nice.
you.
I'm not quite ready to start yet.
Health report. I think I might see,
Hey, Jonathan.
Yep. Afternoon, everyone. I just would like to introduce myself. My name is Jonathan Martinez. I have a background in public health, been working in public health for about 5 years already. Currently working as a policy analyst at NYU Learning Health, and I'm very excited to start this. So first, we are reviewing a letter of support for Start Treatment and Recovery Center, and you can see it's in the package. Do you have a chance to read the letter, or you have a chance to read that? Go ahead. You did? Okay. So, the Start Treatment is a center, is a nonprofit organization based in New York City that provides comprehensive healthcare and social services to individuals struggling with substance abuse, HIV, AIDS, and hepatitis C. They offer a range of services, including medication assistance treatment, counseling, vocational rehabilitation, and adolescent mental health services. What they're asking is that they want to merge with South Brooklyn Medical Administrative Service, Inc. And what they do, basically, they offer a comprehensive range of services aimed at treating opioid addiction. Their programs include substance use assessment, medication administration management, and medical care, including physical examination. And they also provide individual and group counseling to support mental health and recovery, along with referral services to connect patients with additional resources. The letter of so,
Yep. Good evening, everyone, and good call attendance. When I call your name, please acknowledge. If you are joining us online, please remember to unmute yourself. Acknowledge your name and then mute yourself again. We'll start with Jonathan Martinez.
Present.
Thank you. Rosie Mota.
Present.
Thank you. Sylvia Gato. Marcel Amador. Damian Andrade. Jalia Bailey. Joan Body. Esteban Chavez. Jamie Freed. Thank you. Nicole Huang. Cynthia Jeffers.
Present. Present. Can you hear me?
I'm muted because I can't hear you.
I said present.
Hang on one second. And yeah,
Yes.
There you go.
thank you. Barbara Lee, Marilyn Melman, Joanna Romero, Nicole Ruiz. Thank you. By the way, Cynthia, you don't count towards quorum. Pat Ruiz,
Can you hear me?
Yep.
I'm here.
thank you. Pat, you do not count towards quorum. Edward Schloman, Kalina Storma. Thank you. You do not have quorum. We have two hands up.
Okay, again. Oh, so,
We have two hands up, both board members, both attendees, and have called. Thank you.
okay. So the someone can start, I just think. Would you like to present? But before you present, I actually want to take the mic and present yourself to the board as well.
Hello, I'm Rosie Mota. I'm Director of Health Policy, Latino Commission on Age. And we're working in public health and healthy adjacent organizing and community building since I live in Houston, Texas. And now I live here in New York and have to do something.
Thank you. Would like to take a picture and present, start with what the organization is trying to do with the merger and any other relevant information. Thanks so much. Feel free.
Good evening, everyone. My name is Melissa Bernard. I'm the Deputy Chief Programs and Strategy Officer at Start Treatment and Recovery Incorporation. We are currently rebranding. Our new name is Start Care, which really is very fitting to our purpose. We are really trying to provide a one-stop shop for individuals in underserved communities. We are looking to merge with South Brooklyn Medical because we realize these services that we provide and that South Brooklyn are really instrumental to our community, making sure that they have a safe place that they can receive services for individuals who may have lack of access to care. So Start Treatment and Recovery, as you heard, we provide opioid treatment services. We also provide mental health services. We also provide integrated primary care, such as Hep C and HIV testing support. We are providing these additional services to South Brooklyn. They also have a much smaller team, and we are located in Manhattan and in Brooklyn. We have 3 clinics in Manhattan, 3 clinics in Brooklyn, Fort Greene, East New York, and Bushwick. And we are looking to provide our expertise to those at they are coming upon a few challenges, and with our support, we can continue to provide those services to individuals within the community who may need them. And offer our support outside of the clinic through our community outreach work that we're doing and training. So we recently received a grant from the City Council to provide community engagement and training. So we provide Narcan training. We do harm reduction by handing out Narcan, handing out Xylazine and fentanyl strips, testing strips. And we also go out to roll the community where you might say, need additional support, in harm reduction to drug use.
What do you mean by harm reduction? Exactly what type of services would you like to bring to this community?
So right now, you have South Brooklyn Medical and they provide the opioid treatment. So they provide methadone treatment to individuals who are suffering from opioid use. What we are going to provide is additional outreach services into the community. So we have the capability of roving parks, roving subways. If you identify, you may need a training session at one of your community meetings, that is something that we can host to educate individuals on what it means to actually have substance use and mental health disorders, reduce the stigma that we are seeing that comes with the use and with having mental health challenges, and also, teach people how they can be of support to either people within the community, their relatives, friends, and like I also mentioned, providing you with supplies such as Narcan, xylazine strips, and fentanyl strips. So individuals can test. We're also partnering with other organizations such as After Hours. They provide syringe exchange services. They clean up the parks to make sure people are using, right? Because there's one thing to say, I want to stop this, but then realistically, you're not able to do that. So how can we, help clean up, right? And make sure that we're creating a safe environment for everyone while we're trying to tackle this epidemic that's happening within New York City.
What does your engagement look like in an individual level?
So we have peer advocates, and these are individuals who have lived experience, and they come into the community and they'll engage with anyone that they might see in the park who might be in need of services. Explain to those individuals, what type of services we have, but also what type of services are out there within the community. We have a referral resource that we have attached to our organization, and we can look up any type of resource that an individual might need and point them in the right direction to that community-based organization. So if someone is in need of, let's say, detox, we're able to identify a detox center that we can send them to. We are also working on having direct transportation. So if you meet someone right now and they say, listen, I really want to work on getting clean, or I'm going through a withdrawal, we can actually get them to where they need to be within that same day.
And what is your capacity to attend to the list of what would be the capacity in that sense?
So right now, if we with South Brooklyn, there's already a team who works at South Brooklyn. What we would do is identify an additional peer support, and we would hire that person to cover that area. Right now, we are about a 20-minute drive from our Fort Greene clinic, and about a 33-minute train ride. I made sure I did it today so I can see the distance. But also on top of that, we just recently received additional grant funding from the city for us to have 2 shuttle vans. So the shuttle vans are going to assist us with transferring individuals from, let's say, the train station to our clinic. So on an individual basis, we will have the capacity to be within the neighborhood. We're currently working on our next funding source. So if this is a location that we will be working on, this is where we will put some of our efforts to get grant funding so we can provide the community engagement to South Brooklyn. All of that is dependent on the city council member. And if they agree that funding is needed within this area to provide that.
So do you have any existing grants from City Council at this moment?
Yes, so we received $600,000 for Fort Greene to provide community outreach. We also received additional $600,000 to provide vocational training in Highbridge, which is Washington Heights in Manhattan. We received capital funding, $380,000 to, launch our mobile medication unit. Mobile medication unit will be providing opioid treatment services to individuals at skilled nursing facilities. Where we're currently looking to, get discretionary funding, meaning funding for the personnel staffing to operate the mobile medication units. And we also received funding for our Teen Start program. We're looking to, get additional funding for that because it was very minimal. And we also received an age expansion to provide mental health services to individuals, 5 years and older. So that's one of the additional, mentions. Oh, and we also received funding for our, comprehensive outpatient program. So when START, began, it was specifically around, opioid treatment. And since our new CEO started 2 years ago, we have been expanding into mental health services. So that COP, that comprehensive outpatient program grant, will allow us to provide mental health services to individuals at, our Fort Greene Clinic, our East New York Clinic, and our Highbridge Clinic.
An additional question around capacity.
Yes.
It would be a very strong recommendation for the staff or the care advocates, which I really like that term, care advocates, and for there to be bilingual staff or even monolingual staff.
Yes.
And also, is everyone familiar with the term harm reduction? Yeah, if you could please briefly
Yeah, sure.
explain harm reduction for everyone.
Of course. So we talk a lot about treatment when it comes to, substance use. And, we also need to understand that some people, they need more than just treatment, right? So not one person is going to say, I'm going to just stop using. So we want to make sure that we provide harm reduction, meaning that they can use safely. And you're slowly, you're supporting the person through their transition, of their treatment. So they might have medication management, which is methadone or buprenorphine, but you're also going to say, hey, if you're going to use, we want to make sure that you are safe. So we're going to give you clean needles. We are going to give you Narcan in the event that you overdose. We're going to give you these test strips to make sure that the drugs that you're using aren't laced with anything that will cause an overdose. There's also, centers that people can go to use safely. And, recently we visited a few of those centers, and it's not what you think. It's actually, it's a well-oiled machine. You go in, you get checked in, there's places for people to take a shower. They also have tea and snacks, and then they can go in the bath. And in those facilities, there are booths, but there's mirrors. So the clinicians are in the middle of the room, and they can see each person who's utilizing, their drug of choice, and they can make sure that they're being safe and that these syringe needles not ending up on the street. They're not, people aren't using in front of your homes, they're not using in the park. That is harm reduction.
It's all within the vein of saving lives and preventing new incidences of opportunistic virus to enter communities as well. That's a big goal of harm reduction too.
Yes, and all of our clinics except one, and that's due to a shift in population within the Fort Greene neighborhood. But all of our clinics are located in areas that have the highest overdose deaths in New York City.
Happen to know what is the rate in this district?
I'm not sure what the rate is in Sunset Park slash.
Also be undercounted, right?
Because, sometimes, and I can definitely look into that. I think the reason why we kind of hyper focus on those other locations, because that's where we are currently. But as we are thinking about, this merger, that is something that we want to consider. We want to really identify what are the needs within the community, and conducting the needs assessment based off of that.
And based on the need assessment, what would be the timeline for that?
So it really depends. We would have to go through the merger first. And then based on our communication with the new organization, then we can have a conversation what they're actually seeing within the community. And then we would in fact, so one thing I didn't mention earlier is that we have a research, and evaluation team, and we are looking to expand and develop that into a research institute for New York City. So with that research and evaluation team, we're actually able to conduct need assessments and utilize that data to understand, what's actually needed within different communities in the city. And that's going to help us know, okay, where do we actually expand into?
With additional capacity that we acquired with our Southwood, how many peer advocates would you looking to hire?
So each location has one peer. Yep. We have one peer, and right now our community engagement program, we're piloting it in South Williamsburg. And we have 2 peers who go out into the community 2 times a week.
Do you have any assessment? What is the results from that? Do you have any insights to share with us?
No, we recently started in September. So we received funding from the Nick's Alliance in South Williamsburg to conduct this type of outreach. And we recently started.
I happen to know how many patients a peer can carry like a caseload.
So the peers don't have a caseload. They are going to pass that on to our counselors. So what they're going to do is they're going to come out into the community. They're going to see what your needs are. Based off of what your needs are, then they will refer you. Now, if it's someone who needs OTP services, opioid treatment services, or needs mental health services, then they can refer them to our organization. We will do an immediate intake, and then they can come to one of our clinics to get an assessment. But if the person is saying, this is not what I need right now, I just need a body wipe, or I need some food, I need some water, I need somewhere that I can go for shelter for tonight, right? That is what the peers are. We're able to provide them with that type of support and information.
And the location 685 Third Avenue, is that the place where?
Yes. Yes, it's gonna stay the same location, yes. And we're looking to expand in that location. So right now, we're actually embarking on our strategic plan within the organization. Like I mentioned, so our CEO, he's been with the organization for 2 years. I have been with the organization for 10 months. And my department is fairly new. And we realized that there was a need for programs and strategy because there's a need for an expansion of different types of services outside of treatment. So we are really looking to utilize the space at South Brooklyn to see how can we expand upon our services. How can we provide food security? How can we provide job training there, right? We don't just want to put a Band-Aid on what's happening within the city. We want to make sure that we are providing additional resources and allowing people to grow and show them their capabilities outside of this disease.
Would you commit to bring services to the community in terms of training for this district?
Oh, yes, absolutely. Even if we don't do this merger. So if it's, I mean, our goal is to be New York City and beyond, right? So right now, we're not in the Bronx, but we just had a meeting in the Bronx to say, hey, what are your needs when it comes to community outreach? I mean, being realistic, it comes down to funding, right? But if we can make a great case as to why it's needed, we have grant writers. And I'm not a grant writer, but I've been writing some grants. And I'm proud to say I'm a part of, the individuals who were able to make over $1.2 million this year because we had a compelling case as to why we need the funding. So if there is a need, we will find a way to get the funding to get the people out here to do what's needed. But as far as coming out to do training, that is definitely that we are able to do.
Them?
Yeah, I get the mic.
Before any more questions, I just want to acknowledge that the member left the channel about. If you have any questions, feel free to ask any questions.
Chair, my best.
Super.
I think we sort of asked this, but what measurable outcomes? What goals, what do you specifically want to reduce to show that the programs have this?
So, one of the outcomes that we looked at, the number of individuals who have been referred. So first of all, the number of people who have been engaged. And engagement is someone that we actually are able to talk to, and provide them with educational material. Then a referral. So understanding what are your barriers and what can we do to assist you with that and provide you with the resources. The next thing is a linkage. A linkage is actually making sure that we have called that particular resource and make sure that you have an appointment. If you need to get there today, then we stay with you and make sure that you're able to get to that location. Now, we cannot guarantee that people are going to keep their appointment, but our goal is to make sure that you have access to it. So we have been building partnerships with people within the community to make sure that we have a contact that we can reach to expedite some of these referrals. So we want a reduction in substance use externally within the community, and making sure an increase in people getting into the appropriate services that they need. You're welcome.
Hello. Okay. Thank you. Yeah, I'm excited to have a start program in South Brooklyn. My questions are a little more about South Brooklyn medical services. Are there any services that they currently offer that they will no longer be able to offer as a result of the merger?
No.
It'll still be a fully operational method.
100%. And our goal as time goes on is to add service.
With that in mind, the grant to add mental health services, that will not cover South.
That won't cover South Brooklyn, but what we have been doing, so like I said, we have 6 clinics. We were able to get one done. This was in January. We were given approval to get startup money for our comprehensive. And then we did another application in July, and that's when we were offered the other 2 locations. So this is not, as long as Oasis has the funding, we are going to continue to apply to have this type of service. The other thing is because we have the age expansion for our mental health services, we can also open up a satellite mental health clinic at any one of our other locations.
And then less of a question, more trying to hear your needs assessment. But in question form, you have capacity to treat pediatric substance use disorders or adolescent substance use disorders?
Yes, so we have a Teen Start program, and that program is located at 124th Street in Harlem. And that was the program that we were servicing ages 13 to 17, and we applied for an age expansion for that. And that's something we're actually able to service individuals 5 years and older. We just got an approval for that in August.
But here in Sunset Park, it will not yet be for
No, not yet. No. So what we would have to do is basically see, once again, right, what does the need look like, and then staff up for that. But it is possible because we have this designation. So every time you would like to actually offer a service at any location. So let's say I have mental health services happening here, but I want to do it across the street. I need to go back to the Office of Mental Health and apply again. You have to apply for every single location. So if we see that there is a need here, I mean, and the goal is that we want to have locations everywhere, but we're trying to be as strategic as possible and build up our staff with capacity. Our Teen Start program is also can be done fully telehealth as well. So that's also another option for us. And we're working on becoming a school-based mental health program as well.
Um, Two quick questions. One question is related to peers are such a really great part of an interdisciplinary team. Fantastic. I love the idea that you're integrating both and substance use and mental health.
Yes.
But there's lots of challenges with that. But when you have outreach teams that are going into the community, are they going to have any tools that will help them to assess when there is a need to refer somebody for behavioral services?
Yes, so currently our peers, we are going out with our director. If it's not our director, then it is our actual chief program and strategy officer. He was the deputy commissioner at DOHMH. So he was part of developing some of the tools that Department of Health is using right now to assess individuals within the community, and we have utilized some of those same questions. So we have a survey. So anytime we engage with someone, we actually conduct an assessment with them right then and there to really see what the needs are. But like I said, there's also an additional facilitator. One thing that we are utilizing our funding for is to hire a LMSW or LCSW to accompany us here within the field. And that's why our director is going with them now. But the moment we have a clinician, it's going to, our teams are really built out with one peer, one LMSW, one LPN. The LPN is to assist with wound care. And we realize that that has become a need, especially when you have people who are utilizing.
On the note, I hope to oversee the street-based outreach team. Homelessness is near and dear to my heart, so I have to ask this. Is there any potential to have overlap with some of the DHS street outreach teams and other acute care facilities who are also speaking to this same population?
Yes, absolutely. So right now, so we have been having meetings with like the ACT team, who provides services in both serious mental illness. We have not contacted DHS yet, but to your point around homelessness, one of the things we're looking into is housing. Our CEO, that is his biggest project right now. He would like to get into the world of housing, but first we kind of need to understand what's happening on the ground when it comes to homelessness, mental health, and substance use, and how it integrates together, and how we can provide prevention. But also, we're talking about the harm reduction, providing the resources that we have right now. So one of our solutions for that, we're actually looking to hire a housing director, which will be very new for the organization, but someone who understands the challenges that come with homelessness.
I have plenty of suggestions, but I won't take up too much time. Thank you very much.
Well, thank you, everyone. Thank you. We will be here. It's a very important topic. Since I sit in social service chair, as well as aging and housing as well. Okay. Several questions here is do you have the dual language counselor for the people who are being treated, especially Chinese and Spanish, in Sunset Park? Do you have counselors to do this?
Right. So right now, at South Brooklyn Medical, they have counselors, but we at Start, we don't. So that's where this is going to be beneficial for us, right? So we're going to be able to provide them with the expertise on how to expand, and they're going to provide us with their understanding of the community and what's actually needed. So they'll be able to say, hey, we're having challenges servicing this community because we lack bilingual Chinese and Spanish counselors, social workers, providers, and that's where we can use our initiative to actually get funding so we can hire people into a language.
Well, unfortunately, it's even without your program, still there's a shortage of it, shortage of licensed counselors, shortage of licensed MSWs, shortage of that. So That's something I toyed the idea of having perhaps free tuition free for those people who are willing to engage in that kind of field up to MSW, toying that idea and perhaps fund that through increased funding through community spending. That's why I like to have that goal. Because you may have the wonderful program, you don't have to license people to run.
Right.
They run really nothing at
Yeah.
all, unfortunately, and or travel to long ranges of distance to get those services.
Yeah, and it's a challenge because we utilize language lines, but at the same time, it's nothing like having that one-to-one with our participants if you speak the same language.
That's correct. So that's what you have to increase the salary for those people who can pursue that kind of line of profession is very difficult. Yes, there are. Next is you plan to expand the methadone treatment center in Sunset Park.
So there's already a methadone treatment center here. So what we're actually doing is trying to save that to keep it running.
This one in Sunset Park right now for methadone treatment center.
The neighborhood throws me off. So I think because it's borderline, so it's on Third Avenue, yes, on Third. So South, yeah, that's in South Brooklyn. Yeah, yeah.
685 Third Avenue, zip code 11232.
At 68th Street and Third. 21st Street. So that's pretty what gets mid, but nothing
Yeah.
south, nothing like that. And Harn, how many locations do you have? Or are you planning to open Harn location in Southbrook?
So we won't be opening up any new locations right now. So with harm reduction, it's actually street-based. So we are going to shuttle our peers into the community, and they're going to literally walk around and identify if anyone needs any support, and they're going to communicate with them, do the needs assessment right there outside in the street, and link them to any resources they may need. Now, if they need something that we offer directly in our clinics, we will send them to our clinic. We will ask them, which is the nearest clinic that makes sense to them. And we will reach out to that clinic and let them know, hey, we have X, Y, and Z coming to your clinic. But we won't be opening up different brick and mortar.
Now, I know it's outside the purview of what we discussed about housing is probably very important for near and dear all of us, especially affordability, especially for low income. Now, I sit in a housing committee and what I propose a little bit radical, but something you can think about. And I ask almost every 6 months of the year, I have advocates from New York City want to increase affordable housing. And affordable housing is hard downstate, downtown over here in New York City or Long Island. But I really want to see more of an advocate willing to put housing more upstate. Because I do know there is dearth of available housing right now that can be held. Now, I understand lifestyles are a little bit different, a little bit slower, and I'm willing to put some proposal for program to support these people for at least a year, learning how to drive, right, and maybe employment support. For upstate, there is available housing upstate right now, availability. Even in Albany, I visited Albany, there is a building that is empty of public housing. So each city of upstate house, the second largest city in New York State is Buffalo, is only 500,000. On average, there's a 250,000 people in most of the cities in Albany. So that's one way we can able to, maybe for families, if they're willing to accept a different lifestyle, I'm willing to propose a long-term 1 year support for these people to learn a different lifestyle because we can solve housing pretty quickly because we lost 250,000 people, more than 500,000 people for the past 10 years. And we lost a lot of people from upstate. So that's something you can think about that maybe expand that housing outside of our borough. This is very hard, it's very expensive. But upstate is available. So that's something for you to think about if you want to divert, because we can solve it pretty quickly. Okay, that's all I have. Thank you very much for my long talk. Sorry, thank you.
Thank you.
Does anyone else have a question? I just want to ask regarding alcohol. Is that also a part of the peer advocate goal? to help
Addressing
alcohol?
Yeah, so, the main purpose of our peers is to, like, when we are interviewing our peers for these roles, we explain, that this is based off of, substance use, or we'll say, okay, this is a peer role for mental health. Each role is identified separately. So if it's for substance use, it's under OASIS. If it's for mental health, it's for OMH. And with substance use, it's a big umbrella, and alcohol is under that umbrella. Now, I think at START, for many years, we have been so focused on opioid treatment. We have a new chief medical officer who began that in March. You see everything is new. So we consider ourselves a 55-year-old startup because we are just revamping everything. We're trying to be innovative because that's what's needed right now. And one of the things our CMO, he thinks that we don't do enough when it comes to alcohol. We don't do enough when it comes to marijuana, and that's me being transparent. And we are trying to identify ways that we can improve upon that. And one of those things is making sure that we have peers who are able to speak to that with individuals of because the whole purpose of having a peer is, we say someone with lived experience, but it's really lived experience, right? And then they can communicate with someone else who's going through this. And you might actually see a difference. You might see someone who's willing to go get help because, okay, I'm speaking to someone who's been here and they have different lifestyle that I thought wasn't attainable, but it is. Because this person has a job right now and they're able to counsel me. So to your point about alcohol, it is something that we have been addressing, but not to the full extent that needs to happen.
Thank you, and I just want to say I appreciate you using the terms substance use versus substance abuse. And yeah, thank you. That's also part of harm reduction is changing language.
Yep, which comes with the stigma. We have to understand substance use, it's a disorder. It's not who you are, right? So you are not, you're not an addict, okay? You might have an addiction to something, but you're not an addict. That defines who you are. And we're trying to change the language. That's where the training comes in, right? And speaking to people within the community so they can understand the difference. And that will actually create a different environment for those people who are seeking help.
Thanks so much. Anyone have any questions? Any more questions? Do we have anyone?
Please raise your hand if you're joining us on Zoom and want to make a statement or ask a question. I see no hands up.
Well, if there's no questions, thank you so much for coming and presenting your case. For the discuss this report. Thank you so much.
Thank you.
So we're not going to be able to vote today. We will have to bring this to the general board, and the whole board will need to vote on it. Is that correct?
Yes, sir.
But we can move on with the.
Can I propose that? Yeah.
When we present this to the whole board, we present it with a committee recommendation to vote yes.
You cannot move anything because we have to.
Yeah, we can. I mean,
That's strong.
yeah, so what we've done in the past for committee meetings that have not made quorum, we introduce a motion at the full board meeting. Usually the committee chair will make the motion, based on this unofficial discussion from the committee meeting. So I'm assuming the motion would be to approve the letter of recommendation. And then it would just need to be seconded at the board meeting.
Thank you.
I have a question.
Go ahead.
My question is, what is the timing of the support letters? When do they need them?
So
We did just, because it's, for a hearing.
sorry. So great question. We actually need the support letter to go to, Oasis. So we're supposed to be meeting with them, in the following week, but they did say that we do have, additional time. I know that's very vague, because Oasis is very vague. So I'm not sure when your next board meeting is, but, you know,
Would you talk
November 12th.
November 20th. Okay, that's good to know, because then I can go back to, Oasis and let them know, we won't be meeting until then. But yeah, obviously sooner than later, but, you have your process, so I'll have to flag that for that.
Thank you so much.
If you can get that date changed, most appreciated. Thank you.
I don't know, you need our letter.
Okay. So I would like to present my strategic alignment for the specific committee, which is going to focus in education, health, and human services. One of the pillars that I would like to present is I would like to make this committee data-driven decision-making committee. So that means that the main reason that I send all this information about the health needs in the community. And just for Sunset Park, what I identify as the main health issues is sugar drinks, physical activity, lack of insurance, fall-related hospitalizations, hypertension, binge drinking, cancer, and heart disease, the leading cause for Sunset Park. That's just an example for the things that I would like to focus. Those are the main issues in the community at this moment for the data that I presented. Also, I would like to bring this committee towards being more involved in the political decision making in terms of being aware of what is going on in the community with elected officials and just seeing exactly what they're trying to do for the community in that sense. And I would like to also align this committee with what is going on in New York City in terms of campaigns, bringing people to this committee to present their cases and to bring resources to the community as well. And those are pretty much the strategic alignments. At this moment, I am open to new ideas and to propose anything that you would like to oversee as well.
Population health is a major issue across the board. And I think to, I'm sorry, I'm not we have lots of individuals that are contending with homelessness, struggling with substance use dependency, mental health diagnoses, complex need cases, and these are very much driven by social determinants of health. I think that should be a major focus for us, especially in the community. There's lots of different elements that we can address. I feel that the concept of promotores is very, very powerful. And I love the idea that you're using the data-driven element of that to kind of look and bring a little bit of focus on what we need to kind of look at within the community. In addition, I would ask that there's a lot of managed care initiatives. Nothing can really happen unless people are connected to care. In that document that you shared, we have a pretty high rate of individuals who are not insured currently. There's lots of different programs. There's essential plans currently that many people have access to, increasing awareness about that for NYC care, for example. resources that offer sliding scale fee, and also looking at different managed care packages that are available to address complex care needs, resources and services for individuals that are more socially vulnerable. And also, geriatric, senior citizens, things like that. And these are things that we often don't leverage, because managed care is such a box, right? But it's not. If we can try to increase awareness of what is available and hold managed care companies accountable. Soapbox over. Thank you.
Thank you. Anyone else have any other suggestions? Yeah, can you just repeat your list one more time? I want to check it again. Data-driven as main focus, develop and recommend relationships with city agencies, to bring resources to the district, participating with elected officials in their initiatives as well, and aligning with public health companies, and plus additional suggestions. I think you have a list that included like hospital, all related hospitalizations and hypertension. Oh, those are just the health issues for Sunset Park specifically, and also I have a list for Barcelona, and unfortunately I don't have any information as of 2018 tell us. For some reason, the Department of Health hasn't collected any data since 2018, and there's not data available for 2020, 2024. Because looking through this packet, I saw a few areas where our district lags behind Brooklyn and New York as a whole, that I think could be reasonable areas to target this committee. Air pollution is a big one, a major public health risk. Similarly, physical activity in the last 30 days. Community District 7 we had those, and I think as was already mentioned, adults without health insurance. It could be a really high yield place to target specifically with our attention infrastructure. And I agree with you. I think those are definitely areas that we need to target.
Really important to have vital documentation in order to get the insurance. So I know it seems unrelated, but it's necessary in order to apply for the insurance. There's a lot of areas of advocacy around that for people who don't have acceptable documentation. So happy to take on that.
So actually, that's one of my other points that I would like members to take ownership of initiative. So if you feel really strong on something, I'll definitely would like to see you taking care of any specific issue on this that we want to do. Also, I would like to schedule a meeting to go through this data so we can all brainstorm and select the top 5 or 3 issues to tackle for the rest of the season, pretty much.
And just to add, I think I love the list of suggestions, particularly air pollution, because I don't think that's something that we talk about a lot in this district. Well, we do, but doesn't get a lot of attention in terms of like rectifying it. And I think these are a lot of the suggestions I think would be great to work in concert with some of our other committees, so like transportation when we're talking about air pollution, because they're really focusing heavily on EQE and Third Avenue. One suggestion that, and she's on, Cynthia mentioned in one of the last meetings, issues with seniors and getting them air tags. So like that would be a really great collaborative opportunity with public safety and the precinct. And I think it just absolutely makes sense to work to collaborate with other communities on some of these so that one, you're not reinventing the wheel, and two, brings a much wider attention from this board and from folks in the neighborhood.
I totally agree with those suggestions. Well, moving forward, we also spoke with Chelsea about, doing a healthcare for the district. And, we definitely need to put a lot of energy on that, to, see what the members think about that specific proposal.
I've done a lot of health fairs. I got you. And also,
Hold on to it.
This is my jam.
oh, don't worry.
So there's a lot of HEDIS measures that are looking around hypertension and the health issues that were noted earlier. So I'm sure maybe there might be space to have a collaborative effort and maybe even back into some funding from NYU to promote some of the healthcare issues and even maybe get people connected to community workers or care coordinators that can help them get assistance with getting connected to other resources that are also covered by managed care plans.
I think it's a great idea, and, I can look into that for sure.
Well, along with health fairs, I work a lot with actually Hispanic-led churches throughout the city. And I think that's one of my, pillars of personal principles is to work with faith communities. Because they are, in my opinion, one of the first responders that we have in the city, especially those who are newly arriving workers, our new neighbors. We do tend to go to faith-based organizations for services, for help, for food, for assistance, medical needs. So I want to say I would bring in faith-based relationships, with depending on the readiness of the church and where they support our mission as well.
Thank you. Also, like I said before, I would really like to bring the whole board, to review the data that we have from the Department of Health. And so collectively can brainstorm and select specific topics to target. I will say in the next 1 to 2 months, I think we should definitely focus on that. And I will encourage every single person here that if you feel strongly about a specific issue, to take ownership of that specific issue, because we all here and we care about our community, and I would like to see that as well. Also, moving to another topic, we have few organizations that they would like to present to the board, specifically, and not to us, but to the committee. Specifically, I'm talking about the ACS Division of Prevention Services, Office of Family Engagement, Grant Street Head Start Program, and New York City Smoke Free. So I will be coordinating with Rosie with the board to start sending those requests for them and to see specifically which dates we will be meeting with them to get more information and to start like in what exactly they are trying to do in the district. And if anyone feels strong about any of these issues, and I will make sure to send them again emails. Just feel free to reach out to me and I will provide my information as well, so we can work together with this.
I think one of my personal priorities for the committee staff is to meet during our board meeting. And that would include if any one of us can maybe give every month is something. For instance, this month is breast cancer awareness, which we didn't, I had to go to a work meeting, so I wasn't present last week, but it's also domestic violence awareness. And it is also time to get the flu and COVID. So if anyone would like to volunteer to give that as an announcement or new business in the November board meeting, if not, I'll do it. But I think every month, one of us should commit to being like, oh, this month, like November is men's health. Also, maybe one of the men's participate in November, whatever it's called. Well, no shade November, right? So that, I think that would definitely help greatly say, oh, this is the committee, come join us, we have a lot of fun, we talk about a lot of things, and we are really, serving for a noble purpose, which is help.
Also, I would like to suggest to bring some of these issues to the mail list. I know that the rest of the business started to send like email. The people, yeah. So one of the suggestions, I think we can put like a specific one, a specific issue, and specific services within the district, so people interested in attending to those specific services, they have to put in, like, pretty much like that. Yeah.
I've worked in emergency departments for almost 10 years, so hospitalizations. Kind of like the emergency department. Could we survey, so this is from 2018, but could we send out to the community or to,
So which one are you looking at? Yeah.
page 14, but just in general, like, could we kind of get a pulse on the community ourselves or the whole
I'm not sure of the capacity of the board.
surveys? Like we did the community budget, right?
I'm definitely like to do something like that, but
Yeah, we haven't done that before to my knowledge, but that is something that we can, possibly do. I know, we have access to, Microsoft Office for our email, but it also gives us the capacity to create forms with Microsoft Forms. So that is something we can look into creating a survey. You're thinking about survey to the community at large? Yeah, that's something that we can definitely, investigate.
Help in promoting it.
Yes, we do, yeah.
That's the part.
Our reach is only as far as our individual, capacity to get the word out.
and I highly suggest if you feel like really into this issue, to take ownership of this initiative and you will receive the support of the board, the committee, including myself, would like to do that.
And no one is alone. I've made many mistakes. Yeah.
Um, I think that's all I have for today. Oh, sorry, someone is in the. Yeah.
I'm sorry.
Yeah.
Maybe Jeffrey.
Oh, okay, sorry about that, go ahead.
Hi, I know Jeremy, we replied, but is there any way that we could get the city to give an updated report? 2018 is a world very different from 2024. And we have many issues that are not addressed on the report. As we know, COVID changed a lot. And I was wondering if we could get an updated study or ask the city when they plan to do an updated study so that we have up-to-date information. I know other agencies or private hospitals and others have done it, but I'm just concerned that the report we're using is kind of in a world we no longer live in.
I totally agree with you.
Jonathan, is that the data that you shared, is that from, New York City DOH?
Yes, from 2018.
Yeah,
I'm going out available in the website again. They don't have anything else. We get you very much information.
The only left current report I've seen is the healthy NYC, but it's not really specific to district.
If people are speaking, I can't hear them.
sorry. Kalina said sometimes, hospitals nearby will have updated data, and that's something we could probably ask,
Yes,
Uh,
yes, that's what I said. I do know that there's some hospitals who did their own data. So I'm wondering if we would be able to get other data to help compound this data or augment the data that we're using from the city. Or maybe we should ask the Department of Health if they have any data they just haven't shared. I'm sure the DOH has post-COVID data on health trends in New York City neighborhoods. I would find that very hard to believe, considering how hard they tracked COVID, that they don't have anything posted.
Look into this, and, definitely try to see who will be the right person to talk to.
Thank you.
Try them to communicate, present the case as well.
Have another hand up.
I'm sorry, just one other thing, just so that we could also, because this is a combined, it's health, human services, there's also education. Schools may also have data on specific things that they're struggling with their students. That might be very helpful as well to steer the committee as to what's affecting them for the education portion.
And that's something that we also need to talk about, because given that our committee has three components, which is education, health, and human services, we would have to, like, talk more about what else to all the two areas.
Yes, thank you.
Hi, it's me, Pat. Excuse my voice. I want to respectfully ask, I know you guys are busy, but the minutes to this meeting, because the audio is horrible and the closed captioning is not any better. And I do apologize. I tried catching up, but I am very interested in a lot of things that I think I heard. So I don't want to make any assumptions or comments on what I thought I heard. So if we could get some minutes, I really would appreciate it. Thank you.
And you still will have the minutes for?
Minutes are just a summary of what happened at the committee, and then that just gets sent to the board, so that it gets shared to the full. It gets shared to the full board meeting.
That sounds reasonable. Thank you.
So then, if that's the case, then I'll ask my question, and if I'm making a wrong assumption, my apologies. Jonathan, you said something about getting politically connected, and then from there, I did not understand. So could I have clarity on that? Only because we can't, I mean, explain to me what you meant. I appreciate that.
So what I meant to say is, So what I meant to say is, supporting the elected officials in this district with their initiatives. That's what I mean when I say political involved, meaning supporting their initiatives in the district.
You mentioned public health campaigns too.
Public health campaigns as well, and other agencies related to the topics that we are targeting in this committee. You have Katia?
I appreciate it. I just wanted to be sure that I didn't hear what we shouldn't be doing. All right, thank you.
All right, thank you. Any other questions? Any other concerns? Anything that you would like to see in this committee?
Yeah, I'm glad education got brought up. I thought I might be in the wrong committee. So got brought up at the end. So, yeah, I'd love for another meeting to focus a little bit more on education, particularly support for our newest New Yorkers and young New Yorkers, so our English language learners, support for students with disabilities and students with and support for their parents, digital and media literacy, and how we're supporting our schools and our parents, and just enrichment. And I was struck by you bringing up Park Slope and Sunset Park, and I'm interested in a similar analysis, what students in Park Slope have access to in terms of enriching high quality educational arts and sports experiences, and what we can do as a committee here to ensure that our kids have access to the same opportunities.
Thank you for that. And I would like you to, if you want to take ownership of this specific issue and work with me and Rosie, to present, similar as we did today in terms of education, that would be very appreciated from us.
Or at least keep holding us accountable. We're both from health space. Well, I am from health space, and education is something, it's all part of the social determinants. So it definitely goes in, but I am definitely not an expert.
Thing in the next location, but I'll definitely would like to learn more from you and work with you in order to bring something like this to the community. And it will be the same thing with human services as well. If anyone here or anyone in Funko is interested in the portion of human services, we will definitely pick something as well.
Janessa, perhaps you should introduce yourself as part of that.
My name is Janelle. My name's Gerda Reimer. I'm a social worker and division director for school-based programs at Center for Family Life. I'm also a partner.
And everyone is listening to himself. I'm not familiar with your names, so I will definitely would appreciate all of you.
Hi, I'm Colleen Storm.
I am Jamie Tree.
My name is Emma Louise. I'm also a social worker, but different specialty. Yes.
We all know the lady who left.
Oh, that was,
Think about it. It'll come to you.
what's the name?
That was the presenter.
No, she lives in the Terrace. I forgot her name.
Oh, Beverly Klein.
Beverly Kleiman. She is very interesting.
All right, so I will definitely get in contact with you for the education portion, and if anyone else is interested in the human services, please let me know. Like I said, the following meetings, we will try to schedule one for the ACA division, Grand Street, and New York City Smart. So I will get in contact with them and receive a email with the information. I just want to know what days are best for everyone to that and time as well. Just to keep that in mind. I know everyone will have different schedules, and I will try to accommodate everyone as much as I can, but sometimes it just don't have to be a certain time. But I just would like to know any suggestions from the people that are here or in some.
Usually, our meetings are at 6:30. You know, some committees, may start before then. That's usually just like a preference. But yeah,
In terms of days, Monday, I'm sorry, Sunday, Tuesday, Wednesday.
So we generally schedule Monday through Thursday. We try not to have more than two meetings a week. And we, like this week, we try not to do 2 days in a row.
So I am planning to do the next one after elections. Please make sure you go out and vote. And you'll hear more from us. And thank you so much for coming today. And we will definitely take the suggestions and we will start working on any issues that we talk about today. Thank you. Any last words?
Just for the next meeting, we can talk about communications, see how comfortable you feel with us. How do we want information to be shared between committee members? Whether that be an email form, a Google Doc, to keep working on ideas. Because there's a lot of ideas, and there's 3 pillars to this committee.
Thank you so much. And I think with this we conclude today's meeting.
Make sure you show strong support for the motion for the,
Well, it's saying,
of the board meeting.
full board is November 12th. Yes, that's the third Wednesday.
You know, November